All right, keeping it fair and balanced, let's bring in Republican Congressman Tom Price from Georgia and talk to him a bit. He is the chairman of the Republican Study Group, also a medical doctor and a member of the House Financial Services Committee. So, sir, I put that question right to you then. Tort reform, a lot of folks in this country want to know why it's not being addressed. Are they going to get an answer?
Look, you can't be serious about health reform if you're not serious about lawsuit abuse reform. But you heard it from Representative Weiner himself. Look, competition, choices, what do we need to get those things done? More government control? Let's be serious. The fact of the matter is, if we move forward with the bill that's currently in Senate Finance Committee or has gone through 3 committees in the House, we will decrease choices for the American people and force tens, if not over 100 million Americans from their personal private insurance onto the government rolls. That's not what the American people want, and that's why they've spoken out so loudly all across this land.
So they're speaking out loudly, but they feel, I guess, in some ways, the people who are against it, that their voice isn't being heard, because clearly it's not being heard. You know, in this bill that we've seen, there's no public option, but Congressman Weiner says you can bet it's going to be back in shortly.
Well, that's what they promised. In fact, that's what Senator Reid promised. He said the final bill will contain a government option, which again means that people will be forced onto the government plan. Now, the fact of the matter is that the Democrats, the moderate Democrats in the House and the Senate, have to decide whether they're going to represent their constituents or whether they're going to represent the president and their leadership. Those two bodies disagree. Those two folks disagree. And if they don't represent their constituents, then the American people will continue to scream to Washington, stop the madness, stop the government takeover of our health care, stop the government spending, stop, stop, stop. And the opportunity that they'll have to do that will be November 2010.
And that's precisely the point. I mean, there's a lot of people out there, Democrats in their districts, who are concerned that if they vote with this public option, they're going to have to confront some difficulties come election time. So what happens to those who are on the fence in their district, you know, when it comes down to voting time? Are you hoping that you'll be able to persuade them?
Well, we would hope that they would embrace the positive reforms that we've put forward. H.R. 3400 is a reform that would make it so that every individual American could have the financial wherewithal to purchase insurance that they pick, not that the government picks for them, that we solve the portability and pre-existing challenges. You ought not lose your insurance if you change your job or lose your job, and you ought not be priced out of the market if you have an awful diagnosis. And decisions, medical decisions, need to be between patients and families and doctors, and then lawsuit abuse reform. H.R. 3400 does all of that without raising taxes by 1 penny. And their bill raises it by at least $1.3 trillion. And there are some estimates, as Senator Conrad has so appropriately pointed out, that it would run to $3.4 trillion over a 20-year period of time. We can't afford that. And what it would also do is decrease the quality of health care. So more money, lower quality care? I don't think so.
All right, Congressman Weiner shaking his head here, and I know we're going to hear more from him on this, and I thank you both very much for being here today.